Good day everyone. So for today's video, we'll be doing the hot water bag procedure. Before we proceed to the procedure, I'm going to inform you that I'm already done doing the hand washing. Now, assemble all the materials such as hot water bag, towel, improvised cotton flannel, improvised bath thermometer, and pitcher with hot water. Place the towel under the hot water bag. And then check any leaks while pouring a small amount of water. Then cover it, then turn it upside down. This prevents accidental burns. Measure the temperature of hot water using improvised bath thermometer by putting it inside the pitcher. And after that, pour the water. Then put the hot water into the bag until it's about one half to two-third full. Expel air from the bag. The air interferes heat condition. Make sure to lay it on a flat surface. Then after seconds or a minute, close the lid of the water bag. Then turn it upside down to check if there's any leak. Wipe the bag with the use of the towel. Place the improvised cotton flannel under. Then wrap the hot bag with it to protect the skin from direct heat. Make sure to do this in an envelope style. After wrapping the bag into an envelope style, bring it now to the client. So, I'm gonna introduce myself and I will explain to the patient what kind of procedure I will apply to her. So ma'am, I am Nurse Jeremy and I will perform a heat compress for you to feel comfortable. Place the bag into the affected area of the patient. But before that, I'll get first the equipment. And then apply it not more than 30 minutes and check it after 5 minutes. We check it after 15 minutes and observe for any unusual teas. It seems like there's no unusual teas. After using, remove the flannel and place it to the hamper. Place the patient affected area comfortably. After that, remove the lid of the bag and then Drain the water to a container. And then after draining the container, close the lid of the bag and then wash and rinse. And after washing and rinse it, assuming that I wash the bag, wipe it to dry with the use of towel. This will protect the bag from moist. Review the patient's order, record, and doctor's order. So, gather the equipments that are needed. And then put the waterproof pad under the injured part of the patient. After putting the waterproof pad on, let's now apply or put the ice bag to the injured part of the patient. Okay, after 30 minutes, now remove the cold compress and assess the skin. And then evaluate the patient's feelings after performing cold compress application. So ma'am, okay naman po ang pakiramdam niya pagkatapos ng After that, remove the waterproof pad. And the next step is to remove the equipment in the patient's tube. So, good afternoon, ma'am. Today, I will perform a tepid sponge bath to you. And before performing the tepid sponge bath, I am done doing or performing the hand hygiene. And now, next step is to cover the patient. We are covering the patient in order to provide privacy. And after covering the patient, we will remove the thin sheet. After we remove the thin sheet, let's now check the patient's record and the doctor's order. So after reviewing the patient's record and doctor's order, I will ask the patient if she can remove her gown. So ma'am, can you remove your gown by your own? Assist the patient because she cannot remove her gown by her own. Assuming that we remove the gown of the patient, let's now check the temperature of the patient. So ma'am, can you gently lift your arm? So the temperature of the patient is 39.2, and ma'am, you have a fever because it's a bit high. But we know that our patient has fever. We have to use cool tepid water. Temperature of the water must be at 24 to 30 degrees Celsius, since we have to decrease the patient's body temperature. Next is we need to use 4 washcloths and put it in the water. And be sure to squeeze it enough to avoid dripping. Apply one on the forehead, one on each axilla, one on the groin area, and then we have to do this for 20 to 30 minutes. Proceeding, I will now be using 1 washcloth and put it in the water and squeeze and fold it into a mitt. Gently sponging the far side extremity first, and start from the hand up to the axilla using the 4 different sides of the mitt. After we rub the arm of the patient, let's now dry the arm by putting the rubber or dry towel on the other side. With the legs on the far side. Continue the same procedure, starting from the toe up to the groin area. And then dry the legs, put the rubber or dry towel on the other side. Now that we are done with the arms and legs of the patient, let's now proceed with her back and buttocks. I will ask the patient if she can cross her arms. So, ma'am, can you gently cross your arms po? And then ask the patient to lift the right knee up. Ma'am, can you lift your right knee? And then I count 1 to 3 when turning the patient. 1, 2, 3, go. Thank you. Dry towel under the patient, under the back of the patient. Using the same procedure, I will be sponging the back of the patient, start from the buttocks up to the upper back. Dry the back and place the patient back on the spine position. So, balik ko na po sa and check the patient's temperature to see if there is a change. And wait for about 30 seconds. Now we will check again her temperature and wait for about 30 seconds. The temperature of our patient is 38.1 and it has lowered a little bit. Checking her temperature again, continue the process once again. It should be normal. And for checking the respiratory and pulse rate of the patient, we'll use the pulse oximeter. Check the patient blood pressure. So all of the vital signs of the patients are normal. The temperature, the pulse rate, and the respiratory rate, and the temperature of the patient.